Okay, I hope I'm audible now. There was a call from Teachment. They were telling that they have uh, means uh, for a time being they have closed the payment option. So those who have not yet to pay, those who have yet to pay, they can pay later on. Okay, so now I will make all these video available for uh, lifetime. Okay, as long as the Teachment app is there, you will be able to refer to these lectures which we have given or which we have discussed during all these 3 months. And I don't know whether we will be completing these in 3 or 4 months, but you don't have to pay more because it was a promised 3 month course and I was unable to deliver the whole course in 3 month time. So we will take some more time without any further payment to complete our course. Okay, it may be 4, it may be 5 months. So be with me and you will be able to refer these lectures in future for lifetime. As long as this Teachment app is there, you will be able to refer these. Okay, so coming back to our point, psychosis attacks the internal organ, especially the pelvic and sexual organ. In this stigma, we find the worst form of inflammation, infiltration of the tissue causing abscess, hypertrophy, cystic degeneration. We have told that these PCODs, if caused by some uh, external factors, hormones, okay, it's not going to be treated with your natural medicine, but still there are some medicines which can be used for bad effects of hormone like thyroidinum. Okay, so when thrown back into system by suppression, this stigma causes dishonesty, moral degeneracy and mania. Okay, next, in treating patients suffering from these stigma, this classification of inestimable value. What classification? This classification. What sort of organs are affected? What part of organ is affected? This classification is of inestimable value, for it immediately throws the simillimum into class of remedies corresponding with the accentuation of the stigma that is outstanding in the case, and this should be considered in its totality. Underline this. Throws the simillimum into a class of remedies corresponding with the accentuation of stigma. Underline this. It will often throw light upon the choice of simillimum that is applicable to individual case and stage of development. When we are considering a case manifesting mixed stigmata, there is always one more prominent, and this will be one require relief. When this is relief, the next is prominence must be cared for until the patient is free from inheritance of generation. Okay, we have told that it is somewhat not possible nowadays to treat a disease, cure a chronic disease in one generation. You will take generations. You will take generation to treat these diseases. Okay, so we have finished our this miasm from Roberts. Now we will come back to our organon where we have left. I don't think that it will be helpful to go to chronic disease now. There are some points which should be discussed from chronic disease, which we will, if get time, we will discuss later on. I will ask you to please number your paragraph in chronic diseases. Number your paragraph in chronic diseases, especially the treatment of chronic diseases, cure for chronic diseases. Number your paragraph and we will refer it. Especially we want to refer the treatment of SORA. Okay, many things we have discussed regarding postology, diet and all that. When we will complete our postology, we will come back here to get those things which have been discussed in chronic diseases. So please number your paragraph at least from the cure of chronic diseases. You will find here in first part, in theory part, you will find a part where a general discussion is there. A general discussion is there regarding nature of chronic diseases and how Hahnemann have discovered. Then you will find the external suppression, what suppression have caused. Suppression of external manifestation, especially suppression of in chronic diseases. You will find firstly from here, nature of chronic disease. Okay, not forward, this, not forward. Nature of chronic diseases, not editor's preface, not translator's preface, all those. After that, where the chronic disease starts, from where the chronic disease starts. This nature of chronic disease. This is one of my teacher have signed it and given me. So it was there. So nature of chronic diseases. From here onward, you will find the description general, what difficulty Hahnemann was facing and how SORA have developed. Okay. Now from here onward, you will see this type of mentioning. This is actually what will happen when suppression have been there. Okay, all these examples altogether, I think 97 or 98 examples have been given from old school. Okay, obscuration of eyes and presbyopia by Hoffman. This is the sources from where he have taken inflammation of the eye, suppression of the primary manifestation of SORA, and in the footnote he have discussed. These are all the result of suppression. Okay, altogether 97 or 98 examples have been given here. Okay, so next again a discussion follows, and then you will find symptoms of latent SORA. Now it will go on, and again the awakening of SORA, where symptom of latent SORA, before awakening of SORA you will get there, and then the secondary symptoms will be there. Secondary symptoms of SORA will be there. The secondary symptoms. Okay, latent, after latent there is discussion on awakening, how these latent have been aroused. We have discussed that SORA is aroused by which conditions more, which conditions arising SORA more. These are the next secondary symptoms of SORA. These full of secondary symptoms of SORA. All these are. Okay? All these are. Now after this secondary symptoms of SORA completed, Hahnemann started cure of the chronic disease. Okay, you will notice that he have not given, like he have given the secondary symptoms of psychosis, SORA, and latent symptom of SORA. He have not given the latent symptom of psychosis. Just psychosis carries only 2 pages. Psychosis is carrying only 2 pages. Okay, next syphilis. Syphilis is again carrying only 2-3 pages. Okay, and cure for syphilis is completed. You will be seeing that there has not been mentioned, there is no mention of latent syphilis, latent symptom of psychosis, secondary symptom of psychosis. This has been scattered here and there in the Hahnemann's writing, like we have seen in the organon of medicine, that facial cancer was, there was a discussion on cancer of the lip, and in the footnote Hahnemann was telling that it is the developed SORA of an admixture with the syphilis. Aphorism number, I think it was 204, where we have pointed out this, that SORA and syphilis, combination of SORA and syphilis. So like he have given the what we call, he have given the latent symptom of SORA and secondary symptoms of SORA, collected those things, but he have not like given for psychosis and syphilis. From where then Roberts is telling all these of syphilinum and medorinum, proving of syphilinum and medorinum, from where the latent symptom and secondary symptoms or clinical observation or plus those provings plus the clinical observations have been collected and presented by authors like Roberts and authors like J.H. Allen. Clear? So these are we will discuss later on, especially now this SORA symptoms. Cure of SORA is also lengthy, and it carries few pages, where Hahnemann in general along with SORA in general discuss the treatment of chronic disease. We will discuss some point here, especially those 3 points or 3 mistakes a beginner can commit. Hahnemann have discussed. We will discuss that. Okay, later on. After this theoretical part, the practical part started, where Hahnemann discussed those medicines. Okay, one by one. Those medicines are coming one by one. Like agaricus is the first medicine here, not the first medicine according to arrangement of Hahnemann, but it is the arrangement of the translator. Okay, and translator is L.H. Teffel, not translator of Materia Medica Pura. Okay. So we will come back to our discussion on case taking. Paragraph number 83, or better to call it aphorism number 83. We have switched to paragraph, now again switch to aphorisms. So the individualizing examination of a case, this is actually switching off from different book to different book is a bit difficult. So take a rest of 5 minutes and I will start. So here again, coming back to our organon of medicine, case taking. What is actually the case taking? It is the knowledge of disease in particular. Knowledge of disease in general have been discussed. Those 3 knowledges. Aphorism number 71, 1, 2, 3. How is physician to ascertain what is necessary to be known in order to cure the disease? Okay. What is necessary to know? This is knowledge of disease. Knowledge of disease in general, knowledge of disease in particular. So case taking gives us knowledge of disease in particular. Case taking. A particular case of typhoid. Each and every individual has his own stamp on that typhoid. By the knowledge of disease in general, you are going to understand that yes, typhoid fever can be diagnosed with these lab reports. There is a step ladder fashion of the fever. There is diarrhea in the first week or constipation in the first week. Later on, it becomes it changes to diarrhea. There are headache in first week. Later on, headache subsided. All these are the general class, means a general, which is indicating the typhoid, diagnosis of typhoid. But a particular patient A with typhoid, patient B with typhoid, patient C with typhoid, okay, carrying their own stamp on that, and that you are going to uh, take in detailed homeopathic case taking. So this is the knowledge of disease in particular that has been discussed from aphorism number 83 onwards up to 104. After 104, these are in sequence. We have told that all the aphorisms can be arranged in a chain, in a sequence. So from 83 onwards up to 104 discusses the knowledge of disease in particular. After that, remember that aphorism number 3 we have discussed. This aphorism number 3 is can be expanded to whole organon, that up to theoretical part. Again, there are those principles have been discussed. After theoretical part ended, when the practical part started, again those things have been expanded. Refer to that lecture if you are confused regarding to that. Now, aphorism number 83, individualizing exam case of a disease. What is that? That is the knowledge, collecting the knowledge of disease in particular, for which I shall only give in this place general indications, of which the practitioner will bear in mind only what is applicable for each individual case. Underline general directions. Okay. There are some special directions regarding the case taking in mental disease, in intermittent disease, okay, in all sort of different kind of diseases. There may be special instruction how to take case in these cases. Now, general direction, when the mental disease is started, and even again referring to case taking, how to take, I have dealt there. When the one-sided disease started, again he will tell that I have dealt it there. Intermittent disease, I have dealt it there. These are, but plus this may be taken care of. In mental disease, this thing may be taken care of. In intermittent disease, this thing may be taken care of. Clear? Of which the practitioner will bear in mind only what is applicable for each individual case. Demands of the physician nothing but the freedom from prejudice, sound senses, attention in observing, fidelity in tracing the picture of disease. Often this question has been asked in your undergraduate examination. What is fidelity? What are the qualities of physician? So these are the some qualities of physician. Fidelity means tenacious attitude. Lage rehna piche. Okay. So other some quality of physician have been given here in aphorism number 98. That special circumspection, patience in an eminent degree, tact, knowledge of human nature, caution in conducting the inquiry, body language you can add here. Okay. Tact, knowledge of human nature. This is also one of the important thing to know. The knowledge of human nature. That is why I have referred books by Desmond Morris. Those are the books which by reading those books you will understand the knowledge of human nature through the anthropological viewpoint. Next, aphorism number 84. 83 plus 98 in the bracket. 84. The patient details the history of his sufferings. Number one source. These are the sources of case taking. Number one source. Patient. Those about him tell what they heard him complain of, how he has behaved, and what they have noticed in them. This is number two. Those about him. Okay. Third, the physician hears and remarks by his other senses what there is of an altered or unusual character about him. Underline this. Three sources complete. Patient details, those about him details, physicians observe. By his other senses, he writes down accurately all the patient and his friends have told him in very expression used by them. In very expression used by them. Underline this. What they are telling, Jala telling Jala. If you don't know the meaning of Jala, you write down the Jala. Later on, confirm it with burning or what. Jontana, Batha. This is two meanings, and no one can tell you, any Bengali native speaker cannot tell you what is the actual word for batha or jontona. Both are pain. There is a difference of intensity. Jontona is intensify pain, though both are pain. The single word for in English language is pain for both. But writing that only pain is not justified for jontona. Dr. Babu, jontona ache. Okay, তারপর যন্ত্রণা চলে গেছে, ব্যথা আছে, have the intensity have come down. No one will tell the exact, no one will be able to tell you the exact expression of this, exact English expression for this word for this. Okay, so that is why he's telling in the very own expression of them, keeping him silence. Okay, keeping him silence, he allows them. We are discussing aphorism number 84 from Organon. We have completed Robert's philosophy, chronic diseases, and we will come back to these chronic diseases after we have complete our posology here. Then we will come back to the chronic diseases of Hahnemann. So aphorism number 84 we are discussing, very expression used by them, keeping silence himself, he allows them to say all they have to say. I have told you before that during our very second year of our BHMS, one of our teacher, a revered Organon teacher, told us just in his clinical class, told just go in the IPD, go and listen to the patient for half an hour or 45 minutes. We just listen. He have instructed us to not to utter a single word. Just tell the patient ki hoyeche. Bas. No likhna padna, sirf sunna. Don't interrupt the patient and don't write up the complaint. Just listen. This is called active listening, and this is much required during our case taking. Active listening. Only when patient is going here and there, then just pull him to the topic, and this active listening is going to help you. It's sort of two things are very helpful in this kind of keeping yourself silence and listening to the patient. Number one is you are draining the patient as much as you can. The patient will able to tell you as much as he have, because if you are going to interrupt the patient, the thing will not come out. That is have been discussed in a footnote. Okay, so keeping silence and able to listen is a quality you should develop. It is a quality you should develop. No one nowadays, no one is going to listen. Anyone nowadays, this is a common phenomenon. Everyone wants to talk, no one wants to listen. So if you are giving your patient a gateway to tell what lies there, modern, if you are practicing in city, this is most common thing. The loneliness, have you know that in Britain they have constructed a ministry for loneliness? Why it is there? Because the people are suffering more loneliness nowadays because there is no one to listen. So just give your patient a way to drain themselves. Okay, and it will give your patient a catharsis. Okay, catharsis is a technique, psychoanalytic. Those who are practicing psychoanalysis, they are using Freud's school of psychology. They are using this. They are telling their patient to sit down on the couch and whatever comes in mind, just go on telling. This is catharsis, and this will give your patient a sort of relaxation of the emotional burden they are carrying. If this is not emotional burden, it is okay. If some physical, but often psychosomatic disorders are there where you have a somatic complaint, but the origin is in psyche. So you have to, and people used to ask me, my friends, even in my internship itself, just that lesson of my teacher have so much impact on myself that I started listening to my patient. So just try to listen to your patient as much as he is speaking. Just when he's going here and there somewhere, pull him down to the topic. This is your active listening. Acha, tarpore, acha, thik ache. R. This is why I have developed that. My friends were asking why the patient are crying before you. Many patients in my clinic, in my internship days, in my PG days, all patients who are carrying the emotional burden come to the patient's table, patient's chair near me, and they started crying. They are not crying by themselves. I made them comfortable to cry their emotion out. And this is your duty to make your patient comfortable so that they can uh, unload their burden. You are a physician. Now, go to aphorism number 178, I think. 175. Okay, aphorism number 175. In one-sided diseases of first kind, it is often to be attributed to the medical observer's want of discriminant, that he doesn't fully discover the symptom actually present, which would enable him to complete the sketch of the portrait of disease. This is your lacking that the case has out to be a one-sided. Okay, if it is true one-sided, okay, you have tried your best. But if it is not, it may be that you were unable to drain your patient. बोलने ही नहीं दिया, तुमको complete करना है sensation, you have to complete the present complaint with sensation, modalities, cause. बोलने ही नहीं दिया patient, तो कैसे आएगा? How it will come? In our rush to complete the symptom, we forgot something important. Okay, that is why this is very important. Keep silence yourself. Refrain from interrupting them. The footnote: every interruption breaks the train of thought of narrators. Okay, Freud comes at least 150 years after Hahnemann, and Hahnemann is saying this in 1810. Okay, and Freud was telling this at least 150 years after that. Okay, how genius was Hahnemann, that this refrain, every interruption breaks the train of thoughts of narrators. Okay, this is actually Freudian concept. We cannot tell that Freud has cheated from Hahnemann. No, it was his own discovery, but that Hahnemann have told it before. How much before? How many years before? Unless they wander off to other matters. Unless they wander off to other matters. You will find this often with Lacaisse's patient. They are those who are over talkative. They will jump from a story to, you have to pull him down. And refrain from interrupting them unless they wander off to other matters. The physician advises them at the beginning of the examination to speak slowly. Okay? But I don't think so. This is necessary to advise with the all due respect to Hahnemann and his attitude in this. I don't find it necessary to ask patient to speak slowly. Let the patient speak with his own pace. Okay? If you are asking the patient, bounding the patient, हमेशा उसके दिमाग में रहेगा, हमको slow बोलना है, slow बोलना है. Don't disturb the patient. Don't ask your patient to speak slowly. Don't interrupt. जिस पेस में बोल रहा है, जैसे बोल रहा है, आने दो. Just let it out. Let it out. And try to note it down. If it is not possible to note it down there in the paper, just make a mental note of that. Don't ask your patient to speak slowly or with any other pace. I don't know if it is translator's mistake that he is making it to speak slowly. I have to search it out. But it is not helpful to advise the patient to speak slowly. Okay, in order that he may take down in writing the important parts of the speaker say. Now, aphorism number 85, how to arrange the record. How to arrange the record. He begins a fresh line with every new circumstances mentioned by patient or his friends so that the symptoms shall be all arranged separately, one below other. Underline, all arranged separately, one below other. He can thus add to any one that may first have been related to vague a manner but subsequently more explicitly explained. Okay, that is where the lacking of our case taking pro forma generally we are getting from our academics. Okay, we are just trying to fill up the form. It is very helpful to have a plain case taking paper, not a pro forma. With the pro forma, you will always have in mind that I have to complete this part, I have to complete this part. That is more or less form filling. That case taking is not the form filling. This is not a mechanical job. It is an artistic job. Okay, it is an artistic job. That is why I have referred previously the books by Pierre Smith. Two books are there by Pierre Smith regarding case taking, the art of case taking and interrogation, homeopathic interrogation, and one book by Kaplan, that is homeopathic conversation. Homeopathic conversation. That book have also helped me to develop my case taking. Homeopathic conversation by Kaplan. Kaplan is a homeopathic physician practicing in London. Okay, he was an MBBS, later on converted to homeopathy. He did his MBBS and then converted to homeopathy and does his MD from London School of Classical Homeopathy, and he is now practicing homeopathy in London. So this is a book, Homeopathic Conversation, very important book to learn the art of case taking. Next, he begins a fresh line. Now it is completed 86. How to complete the record? Now comes the question of completing it. Okay, actually this is completing the symptoms. When narrators have finished what they have to say their own accord, the physician then revert to each particular symptom. If you can, Yasira, if you can read it from here onward, because it is I'm reading it for long, I cannot read now. If you can read it.
The physician then reverts to each particular symptom and elicits more precise information respecting it in the following manner. He reads over symptoms as they were related to him one by one, and about each of them he inquires for further particulars. Example, at what period did this symptom occur? Was it previous to taking the medicine? He had hitherto been using while taking the medicine, or only some days after leaving off the medicine. What kind of pain, what sensation exactly was it that occurred on this spot? Where was the precise spot? Did this pain occur it by itself at various times, or was it continued without intermission? How long did it last? At what time of the day or night, and in what position of the body was it odd or ceased entirely? What was the exact nature of this or that event or circumstance mentioned, described in plain words?
Okay, so actually this is sensation, modalities. In modalities, time modality, circumstantial modalities are coming. What type of sensation was there? What was the location? All are coming. And what is causation? All are coming. Okay, so completing the symptom. Next, 87.
And thus the physician obtains more precise information respecting each particular detail, but without ever framing his question so as to suggest the answer to the patient. So
underline this without framing his question so as to suggest the answer to the patient.
So that he shall only have to answer yes or no. Else he will be misled or answer in the affirmative or negative, something untrue, half true, or strictly correct, not strictly correct, either from indolence or in order to please his interrogator, from which a false picture of the duties and an unsuitable mode of treatment must result.
Okay, there is a bad effect of asking direct question. The footnote discussed the bad effect of asking these direct questions. Number 88.
If in these voluntary details nothing has been mentioned respecting several parts or function of the body.
Now underline this voluntary details. What were up to this? What were we doing? We are just taking the what patient have already told us. Okay, what patient have already told us. We were trying to complete those. Okay, now after these voluntary details, but patient have not told us regarding his head symptom, eye symptom, air symptom. So it is better to go now to other regards. Anything else you want to say voluntarily, you will ask, means voluntary have complete. Now you will ask better what I do in my clinic after all these voluntary details have completed. Patient have said whatever he want to say. Now I start from head. सर में कोई तकलीफ है, चोखे कोनो असुविधा, काने कोनो असुविधा, मुखे कोनो असुविधा, गलाय कोनो असुविधा, like this, going down, हाथ पाए कोनो असुविधा, and you will get the symptom you wanted. Okay, maybe patient have forgotten, but you will, if you are following this anatomical schema, you will find other symptoms of often very important. So when voluntary details have completed, then you will ask these things.
The physician asks, what more can be told in regards to this part or this function, or the state of his disposition or mind? But in doing this, he only makes use of general expressions in order that his informants may be obliged to enter into special details concerning them.
So we are asking, মাথায় কোনো অসুবিধা, we are not asking মাথায় ব্যথা হয়, we are not asking চোখে দেখতে কোনো অসুবিধা হয়, we are asking চোখে কোনো অসুবিধা, we are asking কানে কোনো অসুবিধা, কানে শুধু শুনতে অসুবিধা নাও হতে পারে, ঝিনঝিন করে, টিনটিন করে, কানে রস বের হয়, সেসব রকম অসুবিধা, শুধু পয়েন্টিং ইন জেনারেল দ্যাট কানে কোনো অসুবিধা, so he will describe or she will describe. Next.
When the patient, for it is on him, we have chiefly to rely for a description of his sensation except in the case of faint diseases.
Underline this. What this is chiefly we are relying on it. We are relying on whom? We are giving. We have discussed this point before also. We are chiefly relying on the patient's description. Because why? Because in the minds of 98. Go to aphorism number 98. Read it.
From starting.
Now as certainly
We should listen particularly to the patient's description of his sufferings and sensation, and attach confidence especially to his own expressions wherewith he endeavors to make us understand his ailments. Because in the line bracket because in the mouth of his friends and attendants they usually altered and erroneously stated.
Okay, so we are giving maximum credence to the patient's own narration. Why? Because in the mouth of his attendant or relative it is altered or there is an error in description. Okay, so why we are attaching except in cases of hypochondriac patient, in cases of indolent patient, in cases of feigners of disease. Okay, that is feigned, who are feigning the disease. Disease is not there, so we cannot rely. And except in cases of insanity, all other cases we should attach maximum description, maximum credence, maximum value to the patient's on description. Okay, so next.
When the patient has by these details given of his own accord and in answer to inquiries furnish the requisite information and sets the tolerated perfect picture of the disease, the physician is at liberty and obliged to ask more precise and more special questions. If he feels he has not gained all the information, then
there are footnote. There is footnote. What a special question may be asked? These are next. Read the footnote.
For example, how often are these bowels moved? Was it in exact character of the stool? Did the vital evacuation consist of mucus or feces? Had he or had he not pain during the evacuation? What was their exact character and where were they seated? What did the patient vomit? Is the bad taste in the mouth putrid or bitter or sour or what?
This whole footnote is full of and footnote before it also. Footnote before it, footnote number 2 is regarding all the generalities you are going to ask your patient, and this whole footnote is full of those questions. Hint for concomitant, where you are finding your prescribing symptoms. Now, the last part of this footnote is and etc. See the and etc. This means you can add on here your own questions. Okay, your questions, like we have discussed before, that one of the characteristics concomitant of this natrium mute is that uh, yawning or laughing causing tears in his eyes. Okay, you can ask your question of this concomitant question by your own directly after completing the picture. And if you are in confusion with natrium mute, you can ask this question of concomitant to your patient. Okay, number 90. 90 is the regarding the observation of the physician. Remember, it is always been asked in your MCQ examination that physician's observation have been discussed where. Remember 90 and O, 0 and O for observation. Okay, so observation, physician's observation have been discussed in aphorism number 90. And in this observation, the clinical examinations also comes. Okay, next.
When can I read, sir, 90th?
Yes, 90 for example.
When the physician has finished writing down particulars, he then makes a note of what he himself observed in the patient and ascertains how much of that was peculiar to the patient in his healthy state.
Okay, in the footnote, you will get all the clinical examination and particular observation what we are making during our case taking, how he behaves, okay, how the patient behaves, and what was the facial expression, and how he narrates his symptoms. Okay, we are taking note of that. Narration is important in some cases, like you ask your patient that क्या अच्छा लगता है, কি খেতে ভালোবাসেন, মিষ্টি. This expression, you took a note of that expression and plus before the মিষ্টি. Okay, কি খেতে ভালোবাসেন, সবই খাই, কি ভালো লাগে, মিষ্টি, নুনটা, টক, ঝাল, আর নুনটা. So that is nunta. With the expression of nunta, you cannot prescribe a medicine with bold grade of salty desire with this patient, because that is not that misty or nunta. That is, or two, if the relative is also coming with, both are telling with same expression, nunta, mane chai. Okay, and when he is telling something, there is, you will observe there is a saliva in his mouth. That means it is a most desired. This is the expression you need to learn to catch these expression. मुंह में डालकर मीठा, नमकीन, तीता, खट्टा, क्या अच्छा लगता है, बार बार बोलकर कोई डिजायर आ रहा है, बार बार बोलकर कोई सिम्टम आ रहा है, उसका वैल्यू घट जाएगा. Value of that symptom will be diminished. So that is the importance of the observation in one sense. Other, if the patient is sitting like this and telling you and talking to you, it's not going to open up. This is a protective posture. You have not made your patient comfortable. Okay, you have not made your patient comfortable to narrate his symptom. If you can make your patient comfortable, you will see during the case taking, they will open up with their hand. If the patient is leaning forward, that means he trusts you. Okay, and leaning forward attitude is always of pulsatilla. During our PG days, second year PG days, I think it was in DND, it was second year PG days. We did an experiment, something how this observation is deceitful to you sometime. If you are not well, means you are not well matured. Okay, so we are experimenting with this. Those patients who are coming to us, means me and one of my friends, those patients who are coming to us and telling like this, we are going to prescribe pulsatilla to that patient and trying to get the means analyze the result. After 15 or 14 days, we found that chair was, every patient was leaning forward. Every patient coming to that chair was leaning forward. Why this was happening? And the chair was bhanga. So that was the deceitful of our observation. So be sure of your observation. Sometimes it is often deceitful to you. So that leaning forward attitude, the patient is sitting like this, patient is sitting like this. These are the physician's observation you are making during your case taking. Okay, where there was a twitch on his face, twitching on his face, sparkling in his eyes. If the light is very correct to the patient, you will able to see the dilatation of the pupil also. If you are training yourself much to observe the pupil, you will see the dilatation of the pupil also when he is narrating some important symptom, or when he is happily narrating some symptom, there will be a dilatation of the symptom. If he is not able to narrate the symptom or not want to discuss his symptom, there will be a constriction of the pupil. There will be dilatation of the pupil. If the patient have carrying the mark of fear, there will be a dilatation of the pupil. Okay, that is how you are prescribing opium. So it is needing much training. Okay, for the beginners, it is often deceitful. Like us, we have been deceitful with the posture of the patient and prescribing pulsatilla to them. So in this, for examples, read the footnote.
For example, how the patient behaved during the first visit, whether he was morose, quarrelsome, hasty, lachrymose, anxious, despairing or sad, or hopeful, calm, and etc. Whether he was in a drowsy
यहाँ
state
पर
or
एक
in
point
any
से share, a point से share, and etc. How he behave, all these body languages. Next.
whether he was in a drowsy state or in any way dull of comprehension, whether he spoke hoarsely or in a low tone or incoherently, or how otherwise did he talk, what was the color of his face and eyes and of his skin generally, what degree of liveliness and power was there in his expression and eyes, what was the state of his tongue, his breathing, the smell from his mouth and hearing, what were his pupils dilated or contracted, how rapidly and to what extent did they alter in the dark and in the light, what was the character of the pulse, what the condition of the abdomen, how moist or hot, how cold or dry to touch was the skin of this or that part or generally, whether he lay with head thrown back, with mouth up or wholly open, with arms placed above the head or on his back or in other position. What effort did he make to raise himself? And anything else in him that may strike the physician as being remarkable.
Okay, freezing point. What one of us sir called it freezing point. जो तुमको एकदम दिमाग में बैठ जाए. That the capillary on the nose. It was a freezing point for me for that patient. What we have, I have shared with you in the group, the capillaries. This is a psychotic indication according to Robert, and I have eventually prescribed that patient Thuja. Okay, so though which is striking, you, if patient is coming and sitting like this, is it not striking posture? Is it not a striking posture? If the patient is sitting cross-legged, is it not a striking posture? Why the patient is sitting like this? You have to analyze. Okay, so this will come from much training. You need to train yourself for those. Okay, from 91 onward we will discuss tomorrow. Okay, 91 and 92 is the patient coming from other physician. Okay, what you will do. So okay, any question you are having, you can ask so that we can discuss that in next 5 minute time.
So this means examples, how to means utilize this in clinical practice.
All these examples. All these examples.
Like all these examples.
Okay. How to utilize?
If
How
we
to
can
utilize tongue?
see, but
How to utilize tongue? This will need a further 1 or 2 classes. There are what you will see in tongue. A tongue of Mercurius, tongue of Natramure. Okay. In his smell, how the patient is, if he is offensive, Sorinum, you will think of offensive medicine, Baptisia, Sorinum. Okay, pulse, if there is a heart beating pulse of belladonna, if there is a missing beat of calmia or digitalis, okay, you're utilizing, no? It's talking houty, irritatingly, then brainia, you can think of medorinum. with his body language. You are utilizing the leaning forward attitude of pulsatilla. Like this, each and every point need a discussion for 1 or 2 classes. Okay. So you will learn all these through your training, through your own self. No one is going to teach you each and every point. You will read in book and try to apply on the patient. You will learn this one by one. Even if anyone comes and are on the utilization of tongue, that is not going to be retained in your brain until and unless you have seen by yourself the parallel lines in the tongue of syphilinum. I have learned this in clinic, and I'm not going to forget this for whole of my life. The parallel line I'm seeing and prescribing, getting result. Parallel lines on the tongue of syphilinum. Think of syphilinum where there is, I have discussed that, where there is a parallel lines or linear pathology. Think of syphilitic, antisyphilitic medicines like this. The tongue, different tongue. There are different medicines which have prominent tongue. You can utilize that. Okay.
স্যার তাহলে এখানে যেগুলো সিমটমস গুলো পাচ্ছি সেগুলো যদি পেশেন্টে পেলাম মানে whether he lay with head thrown back, mouth half or wholly open, এগুলো তাহলে এই বেসিসে মানে ওষুধটা দেওয়া যাবে, মেডিসিন সিলেক্ট করা যাবে, আর কিছু দেখা দরকার পড়বে না?
কেন আর কিছু দেখা তো সব থেকে পরে আসছে, ফিজিশিয়ান অবজারভেশন when it is coming। আগে তো অনেকগুলো বলেছেন অ্যানিম্যাল, ওসবকে ছেড়ে এটা ধরছো কেন?
আচ্ছা
বুঝলে, এটা তো সব থেকে শেষে আসছে। what you have observed, you have collected all these things, you have collected the voluntary details, now you are observing your, এই তো সব থেকে পরে আসছে। okay,
no sir, you said that parallel lines for syphilinum, so that's
okay,
why I asked.
that is a pointer. Okay, that is a pointer, that is a pointer for syphilinum. Search it out, that will help you to search your medicine. Search it out.
Okay.
Okay, that is a pointer, that is a pointer. You will get the family history, you will get the past history for that. Okay, that is important pointer to a medicine. But never go on searching your patient during case taking, searching your patient on a medicine line. Okay, that often result in disasters. Anything else you want to discuss or no?
No sir, I will read and then I will ask.
Okay, if you have anyone having any question, they can post in group, they can ping me personally. Okay, we are going to have these classes as long as 4 or 5 months. You won't have to pay much because the 3 months have been completed, and we have yet not completed our syllabus. So we will continue these classes, and I will try to keep these lectures for lifetime available for you. As long as the Teachment app is there, you will be able to refer these lectures. Okay, thank you.
Thank you sir.